The Ministry of Health and Wellness wishes to let you know that no case of human metapneumovirus, HMPV, has been detected in Jamaica and that the Caribbean Public Health Agency has indicated that the risk to the Caribbean is low but may increase. HMPV is a respiratory virus that is related to respiratory syncytial virus, RSV. It usually causes upper and lower respiratory disease in people of all ages. Vulnerable groups, including children under 5 years old, the elderly, and those with weakened immune systems, are more at risk. Like other respiratory viruses, symptoms include cough, fever, nasal congestion, and shortness of breath, which may progress to bronchitis or pneumonia. A seasonal increase in respiratory pathogens is expected in countries of the Northern Hemisphere, particularly during the winter period. Advertisement. Jamaica is currently experiencing the rise in respiratory illnesses normally seen at this time of the year. Influenza A H1N1 pandemic strain 2009 is the predominant strain, 256 cases in 2024, in circulation in Jamaica, followed by Influenza A H3N2, 62 cases in 2024, and a few cases of Influenza B, 5 cases in 2024. No case of avian influenza A H5N1 was detected in Jamaica in 2024. According to Chief Medical Officer Dr. Jacqueline Besazer McKenzie, CD, there was high RSV activity in October, 102 cases, to November, 122 cases, 2024. However, this decreased in December 2024, 7 cases. COVID-19 cases, she noted, remain at low levels at an average of 4 cases per week for the last 3 months of 2024. We are now in the influenza season when an increase in influenza cases is expected. However, the figures are in keeping with what is expected at this time of year. Based on routine surveillance reports, at the end of 2024, weekly severe acute respiratory illnesses, SARI, and influenza-like illnesses, ILI, visits were below alert and epidemic thresholds, added the CMO. Similar to the pattern noted in 2023, in December of 2024, the number of cases of admitted lower respiratory tract infections increased, and in week 51 of 2024 was above the epidemic threshold. The ministry continues to monitor the situation in the hospitals and asks persons visiting health facilities to wear masks to prevent the spread of respiratory infections. As a reminder, all persons are at risk for respiratory illnesses and for transmitting infections. Every effort must be made to safeguard vulnerable individuals, including the very young, the very old, and persons with chronic illnesses that make them immunocompromised. These persons are at risk for severe illnesses. Persons should wear masks in crowded areas, and if they're experiencing flu-like symptoms, they should wash hands properly and avoid touching the face. The National Surveillance Unit in the ministry will continue to monitor the evolving epidemiological situation in Jamaica and analyze sentinel and laboratory surveillance data related to fever and respiratory symptoms. Influenza data are published in the ministry's weekly epidemiology bulletin posted on the ministry's website. Jamaicans are encouraged to practice proper infection prevention control measures, including taking the flu vaccine to guard against illness and severe outcomes. Minister of Health and Wellness, Dr. Christopher Tufton, Wright, observes while a health records clerk at the Spanish Town Hospital. Carlene Lewis, second left, points out features of the electronic health records EHR system at the hospital during yesterday's, December 19th, tour by the minister. Others pictured are health records clerk Jodane Samuels, seated, Chief Executive Officer of the hospital, Jacqueline Ellis, left, and Senior Medical Officer, SMO. Dr. Jacqueline Wright James. Jamaica News. Electronic records system reduces waiting time for patients. Tufton. December 20th, 2024, 4:29 p.m. Eastern Time. Health Ministry urges Jamaicans to do early screenings. Jamaica New.